There is an interesting relationship between COVID-19 and obesity, because the whole world has heard that if patients are obese, if they have type 2 diabetes or other related comorbidities, that their outcomes from developing COVID-19 are much worse. Their need for ventilators are worse, there's longer time spent in hospital, and in fact, the mortality rates are also higher. However, we've done some work and we've looked into a phenomenon that we call covesity, which is the other link between COVID and obesity, that shows that because of COVID and because of the pandemic and because of the lockdown, this is actually resulting in more and more global obesity and local obesity. Eating patterns have changed. There are more online delivery services delivering less healthy food. Mental health has been affected for the whole world, and this has led to more disturbed and disordered eating. And this in turn leads to food being used as a crutch and therefore more obesity. So although we've all heard of the pandemic, that is COVID, there was a greater pandemic with larger numbers well before COVID, and that is the pandemic of obesity. So this really is a pandemic within a pandemic, and we have to do everything we can to help those patients that have really struggled with disordered eating, weight gain, and problems with obesity and related comorbidities more and more now that hopefully we are coming out of lockdown and seeing the new horizon after the pandemic. We've had to make lots of changes because of the COVID-19 pandemic. First and foremost, to health and safety of our patients and our staff, and therefore we've had to change the pathways and ensure that patients isolate, they're tested, they have safe surgery by those around them that are also COVID negative, with repeated testing within the healthcare sector. We also have low threshold for carrying out other tests, such as CT scans of the chest when patients come in with abdominal problems or come in because of the need for bariatric or other obesity-related procedures and have got undiagnosed coughs or other respiratory symptoms. We've had to make a real concerted effort to continue working and deliver obesity-related services and bariatric and metabolic service throughout the pandemic. We've been one of the largest units to actually continue to operate, and when we were allowed to carry out benign elective operating, we carried out nearly 200 bariatric metabolic operations from July 2020 to December of 2020. And again, we have restarted our service almost like normal, but with the added safety checks and pathways necessary to keep COVID away from our patients and our staff as of April of this year. We're therefore more knowledgeable about COVID, we're more vigilant about COVID, and we've not had a single COVID-related serious elective surgical morbidity or mortality in bariatrics, either in the NHS or in the private centre where I work. For our private bariatric service, called Surgical Weight Matters, we don't just have an online platform that is a website. We also have a personalised app for patients who decide to choose bariatric surgery as their intervention, that is a digital concierge that helps them from the time of considering surgery and the different surgical types, all the way through the surgical pathway, and allows the client or the patient to understand the procedures, the alternatives, the potential risks, the benefits, contact other patients who have actually had this sort of surgery with us, but also record their fluid intake, their medical tests and other supplements that they would need to take. Also record their feedback on pain, mental health, satisfaction. But it also acts almost like a pedometer and an activity monitor, as it links to your Apple Health or Fitbit or Apple Watch to record your steps, your activity and your calories burned while calculating your weight loss. And therefore you're able to objectively see the improvements, your performance, and your whole journey with us. This, alongside our dedicated website, allows you to also look at videos and animations and understand the procedures and the pathways in much more detail. It also gives you access to your dietitian, psychologist, and surgical team if you have any questions or if you have any unlikely emergencies with us. We've had fantastic feedback for this service, and all our patients now get this app as part of their journey for no extra cost at Surgical Weight Matters. In many areas, the COVID-19 pandemic has led to complete cessation of all benign surgical activity, and that includes bariatric and metabolic surgery, which helps with weight loss and obesity-related comorbidities such as type 2 diabetes, hypertension, and obstructive sleep apnea. It's also meant that dozens of patients who are waiting for bariatric surgery to help with their infertility or their difficulties with conceiving are now waiting for even longer for this sort of surgery to help them have their families. For us, we have worked very hard to continue our services. We have not stopped during the pandemic, and we have carried out safe surgery for many, many patients with no COVID-19 related complications whatsoever. We feel it's been absolutely imperative to find novel solutions to keep bariatric and metabolic surgery safe within our practice, to give our patients the treatment that they need, they deserve, and ultimately will help them to improve their quality of life and their life expectancy. Making a decision about having weight loss, bariatric or metabolic surgery, as it's also known, is a really big decision. It's life-changing, but it will be life-changing for the better if it's made for the right reasons with the right support, and if you understand that surgery is just one part of a toolkit that we will be able to support you with for long-term sustained weight loss and better health. That includes nutritional and dietetic support and psychological support, as well as really good education about lifestyle and behavioral change before, during, and after surgery. If you have any worries, it's important to be very open and honest so that we can discuss your anxieties and help you understand things better. It's also really important that you've tried other avenues for weight loss and that you understand that weight loss surgery is not a simple solution. It is not a cheat or an easy option. It can be quite difficult, but we are here to support you and also give you the relevant network to be able to help you through any potential problems that you may have, which are very unlikely with our practice, but we're here in and out of hours for you. I would hope that we've learnt from the lessons of the last 18 months. I would also hope that the providers, such as the healthcare systems and the hospitals globally, understand that we cannot just shut up shop and not look after patients because there is a pandemic going on. We must try and give equal care to all patients with or without COVID. Of course, there is a burden on the healthcare system when there are tens of thousands of patients admitted to hospital. And in the second peak here in the UK, when there were 40,000 patients with COVID admitted to the hospitals across the country, of course it was correct to close down benign surgery for some time. But I think we've learned we can work in different ways. We can collaborate differently. We can share data, we can share best practice, and we can also share problems so that we're able to find solutions for difficult situations that you can come across with patients with morbid obesity and all the other medical problems that they have, so that we can still help them with the only intervention that has really shown lifelong sustained weight loss and metabolic change, that is bariatric and metabolic surgery.